My name is Trey Lemley, and my presentation is on speech recognition software. Speech recognition software is an exciting technology with many uses in the healthcare arena. It is constantly evolving and provides major benefits to clinicians and administrators alike. These benefits enhance healthcare quality. Speech recognition technology was developed in the 1970s, but only in recent years has its use by the medical community become more widespread. At first, SRS was not very reliable nor user-friendly. Through the years, however, the technology and accuracy have both improved, and as a result, more clinicians are using it. SRS is more popular in medical disciplines where using an input device such as a mouse, keyboard, or touchscreen to prepare a report is not practical. For example, pathologists cannot type on a keyboard when performing an autopsy. Radiologists cannot type on a keyboard to prepare a report while using the computer to examine images. Raymond Kurzweil was an early pioneer in speech recognition technology. He founded Kurzweil Computer Products in 1974. Through numerous mergers and acquisitions, his company became part of Nuance Communications. Currently, Nuance Communications is a market leader of SRS in the health industry by virtue of its Dragon Naturally Speaking product line. The speed, efficiency, and accuracy of SRS have all increased due to technological improvements. For instance, word template training is a technological feature that helps SRS recognize a user's speech habits. It creates a voice profile. This increases accuracy. In addition, there are regional accent wizards, which helps the SRS to understand languages, accents, and dialects. For instance, SRS can understand English accents and non-native English accents alike, including Hispanic and Asian accents. SRS has medical vocabularies which are context-specific. For instance, SRS has a vocabulary and language model designed for different medical specialties. This improves accuracy. SRS has continuous voice recognition, which is currently the industry standard. This increases speed. It became commercially available in 1998. Before 1998, SRS used discrete voice recognition, in which the user had to pause after every word. Present uses of SRS, mainly SRS is used in medical transcription. In traditional medical transcription, it was a very time-consuming process. The clinician dictated a note or report. The report is then transcribed by a medical transcriptionist. The clinician then proofreads and approves. This creates a long turnaround time, or the delay between the time patients are treated and when their charts are updated. In contrast, SRS immediately translates spoken words into text so reports can be generated quickly, and as a result, a reduced turnaround time, often from days to minutes, is a major benefit. With regard to the uses of SRS in medical transcription, SRS can replace human transcription altogether, or in a hybrid model, SRS can enhance human transcription. SRS translates speech to text, then a human transcriptionist edits the text. Either way, SRS will reduce turnaround times and produce savings in transcription costs. With regard to the benefits of SRS, one hospital found that it resulted in an annual transcription cost savings of $750,000. In another study, SRS improved productivity, reduced staffing needs, and cut report turnaround time by 81%, with the proportion of reports becoming available with 1 hour increasing from 26 to 58%. In a 2009 study, most clinicians felt that SRS allowed them to finish their documentation quicker. Clinicians at a military hospital with a new SRS program concluded that the software was fast and accurate, permitting a patient encounter to be closed the same day. As a result, because of the benefits that SRS brings to medical transcription, clinicians can document real time at the point of care, thus allowing extra time to be spent with patients. SRS offers administrative benefits as well. SRS can provide automatic transcription, translating the clinician's narrative into a coded output, producing a codified medical record. SRS makes data mining much easier, yielding reports containing information for meaningful use reporting, quality measurement, and electronic health records. CMS core measure abstracts can be completed in a more timely manner. Reimbursements can be maximized when patient records are more accurately coded. SRS makes it possible to retrieve patient information by using a variety of voice prompts, such as retrieve patient chart, or allergies, or diet. Finally, the availability of SRS is a good recruitment tool for physicians, especially for those who want to work with advanced technology. On the other hand, along with the benefits, there are problems as well. For instance, while some studies estimate the accuracy of voice recognition technology to be as high as 99%, other studies have shown accuracy rates to be lower than with human transcription, which is one reason human transcriptionists are still needed. A 2011 study that audited SRS errors in the radiology field noted that transcription errors are one of the major disadvantages. One author said, SRS is a double-edged sword with benefits and pitfalls. In this study, errors included deletion, substitution of wrong words, reports with confusing and inaccurate sentences. As an illustration, the SRS mistook words that sounded alike, for instance, renal and adrenal, lateral and bilateral, hyperintense and hypointense. Clinicians themselves cause errors due to their speech habits with regard to pronunciation, clarity, and speed of talking. For example, clinicians in a hurry might speak with fragmented and incomplete sentences. To increase accuracy and reduce errors, users should eliminate disfluencies such as hesitations, sentence fragments, interruptions. A transcription can understand disfluencies and then make immediate edits, but SRS cannot. An SRS-generated report with errors can negatively impact patient safety and health and can raise the risk of medical malpractice as well. With regard to future uses of SRS, currently SRS is used mainly as a data entry tool. However, in the future, it might be possible to use it as a diagnostic tool, for example, to diagnose Parkinson's disease, simply by analyzing voice recordings over the telephone in as little as 30 seconds. In addition, SRS will move to a mobile, cloud-based platform no longer tied to a desktop computer or a computer on wheels, thus providing on-the-go access to clinical data. Further advances in speech intelligence will allow a clinician to accomplish tasks by voice command. For example, to order 2 prescriptions and a blood test, a physician will say, prescribe Captopril 10 milligrams daily, levothyroxine 100 mcgs daily, and order a hemoglobin A1C test. No writing or typing will be required. Intelligent voice solutions and cloud-based medical intelligence knowledge-based systems, for instance, evidence-based medicine and clinical decision support systems, will be accessible by voice command and will provide decision support to clinicians when analyzing patient medical records. In addition, analytics, alerts, and tracking will be derivable from the narrative dictation of the clinician. In conclusion, as SRS has steadily improved in quality and accuracy over time, it has become more widely used in healthcare. It will continue to bring major changes to the healthcare field. It will improve and enhance the safety and efficiency of healthcare delivery. As a result, the public will be the ultimate beneficiary.